Okay, so the heat and humidity can be really uncomfortable, but it can be particularly bad for leg veins. The hot weather can cause swelling, discomfort, and bulging of veins. Those problems are now easier, though, to treat than ever before, so it's important not to ignore the pain. Dr. Deborah Manjoney is the medical director of the Wisconsin Vein Center and MediSpa. Great to see you.
Thank you. Good morning.
I always wonder with this problem with veins in the legs and varicose veins in particular, is it during the summer that because people are wearing shorts and bathing suits you see them more, or are they more problematic?
I think that's part of it. Certainly they're seeing them more and they're saying, oh yeah, I should do something about this. But they actually do cause more symptoms in the summer for many, many people. The reason being the heat can make your legs, the veins swell because the veins are responding to that heat. So they're dilating and that can hurt more. You can get more swelling in your legs with the heat and humidity. And so that leads to more aching and congestion. And so your legs can feel a lot worse just when you want to be active.
Are you often surprised at how long people will wait, and especially as we look at this before and after and you see how dramatic the change is after treatment? Are you surprised by how long some people wait?
I am, but I think there's still the old notion that having varicose vein treatments are horribly painful. You know, or they see that their mother had lots of scars all over her legs and she went through 2 weeks. The stripping, but they also made great big incisions to take out all those varicose veins we see on the surface. And no longer is that the case. We do it all through little tiny needle punctures in the office with local anesthesia. So there's really so much less involved and so much more of a rapid recovery. It's great. Now this is a treatment of spider veins that we're doing. And so we look at veins with a light and we can do sclerotherapy, which is injecting a vein with an irritant to get it to close off and shrink down. So this can be for spider veins or for some of the smaller varicose veins as well.
And how do you treat that? Do you use anesthesia?
For this kind of thing, we do not need an anesthetic because these are very tiny and our needles are very tiny.
Okay.
But when the veins are larger, we're using a local anesthetic, and frequently we will remove the veins through these little tiny needle punctures to give you a much, much better, more rapid recovery.
How is insurance about paying for the treatment of varicose veins? And it's important because we showed a treatment for spider veins, which is a cosmetic problem.
That's right, that's cosmetic.
Very often insurance will pay for the treatment of varicose veins.
That's right. Varicose veins can actually are a medical problem. So if you have symptoms from varicose veins, if your legs swell, if your legs ache, if you get leg cramps at night and you have varicose veins, these are all symptoms that can be shown to be a medical necessity to have these veins treated, and your insurance companies very often and almost all the time will approve treatment depending on which veins are involved.
There's sometimes some steps involved, though, in getting insurance coverage.
And that's why I'm bringing this up during the summer. It's not just because you're noticing them and your legs may not feel as well, but it's also because there's a process that it takes to get the insurance company to approve the treatment, to get your ultrasound evaluation done first, get the insurance company to approve the treatment, and that often is 6 weeks or 3 months of having a trial of graduated compression hose that they insist on. And, you know, I'm not going to say that we don't always, we stick to the rules all the time about the graduated compression hose, but I'm a little bit loose. I say it's up to you. Wear them if your legs feel better, because that's when it counts. But if they don't, just give it a trial. We'll wait the 6 weeks, we'll wait 3 months, give it a trial at least as often as you can, and then we can go ahead and write to the insurance company to get the approval.
Because the reality is that a lot of people wait until the end of the year to do what you consider to be elective procedures.
Right, because their deductibles are paid off.
Right, but start now.
You have to start now if you're going to get to that point in the year when it's time to get something done that you want to get done for less money and less of your own investment, because we get totally filled up at the end of the year. It's so busy. Everyone's trying to get in, and you do need that time lag that you have to start with at least 3 months ahead of time for many, many situations.
Are there sometimes complications too if people feel pain, they feel swelling, but they put off treatment?
That's exactly right. If people get a lot of swelling from the varicose veins, it leads to changes in the skin. And so the skin gets thicker, it may get discolored because blood cells are actually leaking out of the veins and not just the fluid in the blood that can be leaking out from all this swelling. And that leads to much more problem in healing. So if they get a cut or they get an injury on their leg, or spontaneously if they have a little break open of their skin, it may not heal the way it should be, and that's called ulceration. And that's really much more of a problem to deal with, and so it's really better to get it taken care of now while the skin is nice and normal, and healing will be rapid.
And here's the thing, is that treatment has come so far as it relates to veins.
Totally.
It's much less painful, it's quicker, and the downtime is not nearly what it was.
Exactly, and even today, now this isn't covered by insurance, but the newest treatment is gluing the vein closed. And it works beautifully. It can be done in one treatment. You don't need hose before or after. because it's not covered by insurance, you don't need it before, but it's done in one treatment. And you are done. We can do both legs at the same time. It's amazing.
And you can determine maybe by ultrasound if
yes,
someone's
we have
a
to
good
do an
candidate.
ultrasound to see what their veins look like, but if they're a good candidate, it is a wonderful option.
And a good time to have these treated because of the before and after pictures, I think, tell the
Yes,
story.
absolutely.
And to think that you can do it in office in a much less invasive way is
And
wonderful.
stressful situation. I mean, it's in an office. You walk in, you walk out, drive home. Really very
Wonderful.
comfortable.
Great time to get your veins treated or at least looked at. What you need to do is call the Wisconsin Vein Center and MediSpa. Their office is located on Georgetown Drive in Pewaukee. The phone number is 262-746-9088. Go to wimedispa.com.